We want to share some important information about your scheduled open heart surgery with you. To help relieve any stress or fears that you may have, we want you to know what will happen before, during, and after your surgery, and what you need to know and do when you return home from the hospital. On the day of your surgery, you will check in at the front desk. You will then be directed to the preoperative holding area. Your family will be able to join you at that time. The pre-op area is where the staff will get you ready for your procedure. You'll meet the anesthesiologist and nurses who will care for you during the surgery. You'll also have an opportunity to speak to your surgeon and ask any last-minute questions. The staff will start an IV, and the anesthesiologist will put an arterial line into your wrist. This is used to monitor your blood pressure during and after the procedure. Before you move to the operating room, your family will be escorted to the waiting area, where they will be updated regularly during your surgery, which can last from 4 to 6 hours. Let's talk about what's going to happen next in the operating room. Your anesthesiologist will give you some medicine to act as a sedative. When the anesthesiologist is satisfied that you are fully sedated and comfortable, he will insert a breathing tube and connect it to a breathing machine. The anesthesiologist will put a central line into your chest or your neck to improve IV access during and after the procedure. Next, a Swan-Ganz catheter will be placed in your chest or neck. This is a special catheter used to monitor your heart during and after the procedure. Finally, a catheter will be placed in your bladder to drain urine during the surgery. This catheter will remain in place for at least 24 hours after surgery. Now, you're ready for the procedure. If you are having open heart bypass surgery, the surgeon will need some of your veins or arteries to bypass the blockage in your heart. The surgeon will use your internal mammary arteries, which you will get once your chest is opened. The veins needed for the bypass will come from your leg, and the procedure will usually be done with the aid of an endoscope. The surgeon will not need veins or arteries if you are only having your valve repaired or replaced. In order to get clear access to your heart, the surgeon will cut through your sternum, which is the bone in your chest protecting your heart. If you are having bypass surgery, the surgeon will bypass the blockages in your heart using the veins and arteries taken earlier in the procedure. If you are having valve surgery, because one or more of your valves are not functioning adequately, your surgeon may recommend surgical repair or replacement. If you need a valve replacement, your surgeon may use a mechanical valve or a tissue valve, depending on your age and medical conditions. When your doctor is finished, he or she will close your chest using wires. These wires will stay in place forever. But don't worry, these wires won't interfere with any MRIs you may have in the future, and you won't set off any airport alarms. The last step in your procedure is for the surgeon to close the incision in your chest. Let's talk about what you should expect after surgery. You'll be taken directly from the operating room to the ICU or intensive care unit. You will still have your breathing tube in, along with the central line and Swan-Ganz catheter in your chest or neck, the arterial line and catheter in your bladder. You'll also have chest tubes that will drain blood from your procedure. You may have pacer wires in your chest that will be placed at the end of the surgery and will only be used if your heart needs to be paced following surgery. These wires will be removed towards the end of your hospital stay. When you wake up after surgery, the breathing tube will still be there. You need to be awake and responding to directions from the healthcare team before the breathing tube can be removed. This process is a little uncomfortable, but know that the healthcare team will remove the tube as soon as it is safe to do so. Once it has been removed, the staff will concentrate on getting your pain under control and making you as comfortable as possible. Your blood pressure, heart rate, and blood glucose levels will be monitored very closely. Monitoring your blood glucose levels is very important even if you are not diabetic, to prevent infection and other complications. You will normally spend 1 to 2 days in ICU. You will most likely be able to see visitors while in the ICU, but schedules and visiting times will vary depending on which hospital you are in. For visiting hours, please check with the hospital staff. The morning after your surgery, your physical therapy will begin. Before your physical therapy starts, you'll be given a Houston Methodist bag, which will contain a folder with information about your procedure and your heart pillow. If your vital signs are good, your nurses will help you get out of bed and sit in a chair. The nurses will help you sit up and get to the edge of the bed with your heart pillow, which you're going to use to reinforce your chest during activity. When you get to the edge of the bed, you're going to plant your feet flat on the floor. You're going to lean forward, and you're going to push up with your knees. When you sit down, you're going to do the exact same thing by making sure your legs hit the back of the chair. You're going to lean back, and you're going to sit down without using your hands. That's how you'll get up and sit down for the next 4 to 6 weeks. You may want to practice this technique at home prior to your surgery. You will also use your heart pillow to reinforce your chest during your breathing exercises that the respiratory therapist will review with you. Walking is an important part of your recovery. Walking at least 4 times daily will help prevent blood clots and pneumonia. The physical therapy team, along with the nursing staff, will help make sure you meet this goal. You will normally spend 3 to 4 days on the med-surg floor. Before you leave the hospital, your doctor and nurses will talk to you about some activities you'll want to do and some you'll want to avoid when you get home. Let's briefly discuss some of those now. Here are some activity restrictions to keep in mind. Don't use your hands when you stand up. No pushing, pulling, or leaning down to pick up anything heavier than 10 pounds. You will not be able to drive for 4 to 6 weeks. You won't be able to return to work for 4 to 6 weeks. This, of course, depends on your doctor and the type of work you do. Be sure to schedule a follow-up with your doctors for 2 to 3 weeks following your surgery. In 4 to 6 weeks, when you're completely cleared by your surgeon and your cardiologist might suggest outpatient cardiac rehab. Outpatient cardiac rehab is done at an outpatient facility. It's usually 3 times a week for about an hour per session. Your daily diet should consist of heart-healthy foods. A nutritionist may speak with you about this before you leave the hospital. We hope this video has answered any questions you may have had and helped alleviate any fears. If you have any other questions at any time, don't hesitate to ask your doctor or any hospital staff member. Thank you for watching, and thank you for choosing Houston Methodist West Hospital.